Welcome back to the Digital Health and Wearables series. Today I have another magnificent episode for you, but before I go ahead, let me remind you to subscribe, check out all the previous content there, magnificent guests and subjects there. Also acknowledge our partners, the digital health platform Clinicians and our series partner Fujifilm Healthcare. But today I'm truly excited to introduce you to Tomaž Gornik, is the CEO Better. Tomaž, how are you?
Great. Glad to be on your podcast.
Brilliant. Thank you so much for making the time and connecting. I know you are busy. We're talking about that. We know each other for quite some time.
Yeah, it's digital health is in the end a smaller community, and I think those of us who have been championing this field for some time pretty much know about each other.
Brilliant. And today we are here to talk about value-based healthcare. And Tomaž, the first question that I have for you is, how is the healthcare industry evolving and how can value-based healthcare can be achieved?
Yeah, I'll stick to the European experience, which is where we are most at home. And I can say I see three different trends which are shaping the industry. The first one I would say is a shift in care. And by that, I mean, it's quite clear now that care is shifting from the acute, from the hospitals to the regions, community, and actually to the home in some cases. That also means we are able to start focusing from the acute care to prevention, which is obviously what we want to do. The second trend I see is that the patients have a much more active voice. They want empowerment, engagement, and to do that, we need to give them access to their health data. So this is the second one that I see. And then the third is that we actually see a big focus on data, which for our company has been our mantra for forever. So thinking about data first and application second. But because of the pandemic, what I now see is that even very high up politicians realize that they cannot make basic decisions on how to run the country, when to lock down, if they don't have good data coming from the healthcare system. And they also realize that they do not at the moment have good data. So I would say this shift in care, empowering patients, and this focus, renewed focus on data are the three things which I see are key.
Oh, brilliant, Tomaž. Some magnificent points there. Also, I'm seeing things changing. Care where we are. With the pandemic, we were forced to be in our home locations and lockdowns and everything. But what you mentioned is very interesting about the patients start to having the different. We're starting to see the patient voice coming out, and data has a clear focus. And I was at IMSS Orlando now. 2022, about a month and a bit back, and the focus on data was very, very strong.
Yeah, and I think, this empowering thing is obviously proven also to be better for the patient in terms of outcomes. So we definitely need to have the patient empowered. It's going to lower the cost, improve care. And of course, it's the right thing to do. And you would be surprised how difficult it is now for the patient to get access to their data, even though in most countries this is legally required.
Well, fantastic. Moving on to the second question. What needs to happen in order to support clinicians to deliver value-based healthcare?
Yeah, I think, if you think about how we build applications today, you will realize that we built applications for the institution, not for the patient. So think about the EHR systems. They're built for hospitals, for primary care, for community care, and so on. The right thing to do would be to build around the patient, not around the institution. And I'll give you one example. So we just recently, end of last year, won a project called One London Care Planning, Dynamic Care Planning. And instead of taking data from different systems in different hospitals, community care, and so on, what we decided to do was to centralize the data on top of a shared, inside a shared care record, build the application to coordinate care on top, and push it out to the institutions to use, but keeping the data centralized the entire time. So this has many, many advantages. One is that all the care providers have a single source of truth. And in the case of these care plans, there could be 15 different providers, anything from ambulatory services, community health, palliative nurses, and so on, and of course the hospitals as well. But it's not only that, it's the current model where we ask hospitals to send some of the data to a shared care record is really broken, because in order to do that, each vendor has to upgrade their system, and then the hospital has to go to the new version, which in some cases takes years for everybody to get on the same page to enable just, you know, some new data to come into the shared care record. So I call this turning the architecture inside out and actually having the data at the center and applications pushed to the end users in different institutions, which means that we can quickly iterate, add new care plans, and of course, always have the data, the single source of truth in one place. We're going live in One London in about a month, and we will be adding new care plans as we go along. And it's really, really a great example of 5 integrated care systems of London, building something around the patient, this time not around the institution.
Fantastic. That's such a great, groundbreaking point there. We all hear about a building from the bottom-up approach, and we talk about the patient at the center. Now, as you know, Thomas, is a discussion around co-creation involving patients, but that infrastructure challenge that you mentioned, that's truly, truly groundbreaking, because as you mentioned, changing systems might take years. That's why innovation actually moves so slow, because people are actually stuck with old systems, hospitals, care systems, and everything. So that's really great work. Thank you so much for sharing that, Thomas. And moving on to the third and last question, the question that I have for you is, what role does data play in healthcare of the future?
I think it has a central role. So I've always believed this when we started with this data first, as I call it, initiative 12 years ago. Not many people were listening, but now, because of the trends that I mentioned before, including the pandemic, it's front and center. So the idea that you know, people buy applications without thinking about the data has cost us a lot in healthcare. As you know, even 20, 25 years ago, I was hearing the data must follow the patient. The data must follow the patient. We really haven't achieved this. What's happening now is the data follows the patient only when the patient carries it around in a paper box. So we really need a different approach. And I think the approach is very similar to what I explained before with the One London example. But in any case, you know, think about this. So in healthcare is different than other industries, because you need to keep data for the lifetime of the patient. And this is 100 years. You know, there is no application that can last 100 years. So applications will come and go, the data must stay, which means we need to separate these two. And by separating the two, we have the ability to, for many applications, to access and actually collect data from the same source. And this is unique, and I think it's the way forward. So what we are seeing now is that to ensure the quality of data, we need to have the same data format from capturing the data all the way to care, to secondary use, research, and so on. Because what needs to happen is this research, the outcomes of this research have to be pushed back into the care process to close the loop. And this is rarely done. And one of the reasons is, of course, that the data is all over the place. We somehow put it together for research, but putting these insights back into applications is very rare. But it is the future. Now think about personalized medicine, where you have an N of 1, right? So all of this data that you have collected around this patient has to be used to improve his care for him and for similar cases down the future. So I'll give you one other example. So just middle of last year, we signed a contract with the Christie, the largest cancer trust in Europe. And for them, it was a huge issue because all of their applications held their data in their own formats. So they do about 600 clinical trials a year, which means that the research team had a huge data department that was just converting data from one format to another. Now they've chosen to go down this path, which means that the first applications which they've built are already storing data in this open format called OpenEHR. And as they add other applications, they will not create a new format. They will use the same one all the way through to research. And this will create a lot of efficiencies for the organization. But of course, also, it will be easier for them to put this insight back into the care process.
Brilliant. Tomaž, what a way to finish. Thank you so much for sharing that amazing insight around data and how things are changing, and also what the future looks like and what needs to be done, really. That kind of flexibility, but using a different approach. So, Tomaž, I finish all my episodes. It's not really a question as such. It's called 1 minute of fame. You can mention anything around the industry, your achievements with the company, personal achievements, anything whatsoever before I round up. 1 minute of fame, over to you.
Yeah, so again, I will just repeat the message we've been saying to the market. You know, when you're about to look at the next initiative, start with the data and then think about applications. I know it's easier to do it the other way around, but you will create a lot of issues for everybody using this data down the line. And I think now people understand this, and it's really refreshing. Unfortunately, it took a pandemic to change healthcare. But now that we are here, we should really take advantage of this change and start focusing on the data.
Fantastic. Brilliant. Tomaž, let me thank you so much for your time, for this amazing expertise and so much value focused on value-based healthcare and open data and health data. Yeah, thanks so much for being in here with us.
Thank you, João.
I'm gonna round up now. So to our viewers and listeners, make sure you subscribe. Also, connect with Tomaž. I'm gonna post here his LinkedIn and his socials. He's a true expert, done lots of work in the industry. Make sure you connect, ask questions about Better and about his work. And to round up, let me acknowledge our digital health platform, clinicians and our series partner, Fujifilm Healthcare, and I'll see you all next week.